Hello, my name is Gayatri Devi, and I'm founder and director of Park Avenue Neurology here in New York City. I've been working in the area of Alzheimer's disease since 1994, and many of the things that I was taught and that I believed early on in my career, I have since found to be untrue. Number one, that Alzheimer's is a single disease. This is incorrect. Number two, that there's nothing that can be done for patients with Alzheimer's disease. This is also incorrect. There are many things that we can do with currently available treatments that can help improve quality of life and stabilize patients. Number three, that Alzheimer's disease is invariably progressive. This is also untrue. There are different types of Alzheimer's disease, and depending on the type of Alzheimer's disease that one of us gets or someone we know or love gets, then the progression can vary. Here we're going to be talking about different ways of looking at the types of Alzheimer's disease. First, we're going to look at the types of Alzheimer's disease using MRI data. Then we're going to be looking at it using neurocognitive data. Then we're going to be looking at it using pathology or autopsy data. So on MRI data, there is limbic predominant Alzheimer's disease, and that's where Alzheimer's affects the area of the brain called the hippocampus and the temporal lobes. And then memory is mostly affected here because the hippocampus is a conduit for many kinds of memory, particularly memory for facts and events. Alzheimer's disease is hippocampal sparing Alzheimer's, and here the other parts of the brain are affected, so not the area of the hippocampus, but the rest of the brain. This type of Alzheimer's is usually more difficult to treat. It progresses more rapidly, occurs in people earlier in life, and it'll affect people's ability to speak, their ability to understand, and may affect their ability to read, their ability to perform activities of daily living. The third type of Alzheimer's is what's called typical Alzheimer's disease, and there you have involvement of most of the brain and also particularly the areas of what's called association cortices, which is the parts of the brain that connect different sections of the brain with each other. There's what's called minimal atrophy Alzheimer's, where the entire brain appears relatively healthy, where there's not one area where the pathology is more evident. And this type of Alzheimer's too, in my opinion, occurs in older people and seems to not progress as rapidly. There are at least 8 different types of Alzheimer's disease based on how people perform on cognitive tests. And depending on the type of memory problems they have or language problems, so whether they have mild or moderate memory problems, whether they have visual problems, that will affect the area of the brain that's affected, and it'll also affect how quickly the illness progresses, how much trouble they have with activities of daily living. So that's another way to categorize Alzheimer's, looking at the brain and determining where in the brain there's the presence of the pathology. And based on this also, you can divide Alzheimer's into at least 3 different types: limbic predominant, hippocampal sparing, or typical Alzheimer's or diffuse Alzheimer's disease. And there you can see that just based on the way that the pathology deposits in the brain, the progression can vary as much as 1 point of mini-mental status per year or up to 5 points a year. So it's very important to know that there are different types of Alzheimer's. When you talk about drug trials, is that unless you know what kind of Alzheimer's the patient has, it's very hard to determine whether or not the trial is helpful, because if you clump all patients with different types of Alzheimer's together into a trial, you may not be able to really determine if a drug is effective or not. If we regard Alzheimer's as a single disease and not acknowledge that there are many different subtypes in it, then we stigmatize all patients. We conflate or confuse the most ill of patients with even the mild patients who may never ever get to the really ill impaired patients level of functioning, and treat everyone the same way. And this is not good medicine, nor is it good for society, and it certainly isn't good for the patient and the family. Well, I hope that was helpful in delineating the different types of Alzheimer's for you and helping you understand that it's more important to know about the type of Alzheimer's that someone has or that you might have, rather than the stage of Alzheimer's that someone has, because it's more the type that determines prognosis, response to treatment, and quality of life over time. It's also important to know that Alzheimer's rarely exists by itself. It's almost always accompanied by some kind of vascular disease of the brain, including small strokes, Lewy body disease, and other types of pathology, and that too will affect prognosis. And finally, know that each of us has a very individual brain, and the brain and the strengths and weaknesses that we bring to the condition will also help to influence how the illness progresses. Well, thank you very much. I hope you found that helpful.